Rotator cuff tears are extremely common, and they tend to be, we would almost kind of call bimodal, or there's maybe two different ways the rotator cuff will fail. Often in younger and more active patients, it's traumatic. So, say a 45-year-old carpenter falls off a building and their arm gets wrenched, or a young baseball player, has a series of, bad seasons and the shoulder gets sore. Versus older patients who the rotator cuff will tend to just fail from time and life and wear and tear. It's not uncommon to see a patient in their 70s who doesn't remember any history of trauma, and yet they have a tear on their MRI. Actually, if you look at some of the studies that have been published on rotator cuff disease, we know that as you get past age 70, more than 50% of patients have something going on with their rotator cuff, and it's just a natural degenerative progression. So the good news for those patients is a lot of times we can manage that non-surgically, because it is just sort of like, getting gray hair kind of progression. It's just one of those things that comes with time. So the younger patients who have more traumatic injuries more often need surgical management for those things. Typical rotator cuff pain almost isn't so much felt in the shoulder as patients tend to feel it in their arm. They'll come in and saying, it's not my shoulder, it's my muscle, it's my arm, it's my bone. They kind of point to the mid-arm area. Very frequently happens at night. Oftentimes will wake people up. It'll throb through the night. It can cause sharp pain with sudden movements of the arm, really depending on the person. Many rotator cuff tears can be diagnosed just by starting with a basic physical examination. So obviously during an initial consultation in the office, you're going to give the doctor your history, you're going to explain your symptoms. If your symptoms sound suspicious, you'll have a basic physical exam. Oftentimes things you'll see on an exam are weakness of the rotator cuff, limited range of motion. Patients will have difficulty, reaching the arm up behind their back, sometimes difficulty overhead, difficulty sleeping, as we mentioned. Depending on a lot of different factors, you may or may not get an MRI done. So, like I mentioned before, if you're a patient who's more likely to have a wear and tear type injury, we don't necessarily order an MRI right away. Oftentimes we'll start with things like physical therapy, sometimes a cortisone injection, whereas a patient with an acute tear or a patient who hasn't gotten better with other means would be more likely to get an MRI. Once you have the MRI, it'll tell you a lot of things about the rotator cuff. It'll tell you the size of the tear, the dimensions from front to back, from side to side, how many tendons are involved. It can often tell you how old a tear is. Is it recent? Is it chronic? And those factors go into the decision making on whether that can be treated non-surgically or surgically. Surgically repair of a rotator cuff, I hate to say it kind of gets a little bit of a bad reputation, out in the community, just because many people know it is a fairly long recovery, thankfully with very good results. Most studies would suggest at least 92 to 95% good or excellent results with rotator cuff repair. It usually requires about 6 weeks in a sling after surgery. Most patients, it takes about 3 months before they're predictably reaching their arm overhead, and typically most surgeons, I think in our group, would quote about 6 to 12 months of total recovery before you regain your strength and endurance. Probably some of the more interesting procedures that we do in surgery, or I guess challenging, would be along the lines of people with chronic rotator cuff deficiency. So, a rotator cuff tear, if it's addressed in a good time range, will often be something that does very well over the long term. Patients who have old rotator cuff tears that were either fixed and didn't heal, or they were never fixed and they progressed over time, they run into a very difficult situation where they'll often get arthritis and they get very significant shoulder dysfunction. Many of those patients come in and can't even lift their own arm away from their body. There's a procedure that's been used in the United States only since about 2004. It's called a reverse total shoulder replacement. It's specifically indicated for patients with chronic, unrepairable tears of their rotator cuff, significant pain, and lack of function. And it's an interesting surgery and one of the most rewarding things I do, because it's really just remarkable the way it gives it their function back. So patients who meet me and can't lift their own arm away from their body may come back in 6 months with their arm all the way overhead. And so it's a very gratifying procedure to do. Obviously not every patient is indicated for it, and like anything, you want to take a conservative approach, try to avoid the procedure if you can, but it can be very gratifying.